Thank you. Good afternoon, everyone, and thank you for joining us. Thanks for taking time out of your day to join us for this webinar. We have a great panel with us today. I'm going to introduce them to you. We have Doug Weinstein, who's the Vice President of Operations for AKAM. We have Robert Lozano, who's the Vice President Environmental for the Water Restoration Group. Richard Rodriguez, Senior Vice President and Condo Practice Leader for the state of Florida for USI Insurance Services. My partner, Jamie DeCovna, shareholder with Becker, and I'm Howard Pearl, also a shareholder with Becker. So as they mentioned earlier, we have received literally over 100 questions when people registered for the seminar. I have picked out what I think is a pretty good representative sample of those questions. We're going to start those in a minute. If while you're on the webinar, if you have a question, you can submit it. I believe there's a way to submit a question. And we'll go through these and hopefully we'll answer your questions. So we'll get right to it. So the first question we're going to ask is for Richard from USI Insurance. And the question is, what exposure does the board and association have if we are sued, if someone gets sick from the COVID-19 and accuses the associate and files a lawsuit against the association? This question was submitted by John.
Well, there's actually multiple policies and every claim is different, as everyone knows. So let's talk about the policies first. All associations will carry a general liability policy. A general liability policy is designed to cover bodily injury and property damage. Something physically happened. So that's one policy. The other policy we have, which is very critical, is the directors and officers liability policy. This does not cover bodily injury or property damage. It covers the association, the board members, the subcommittees, and board members when they're off of the board personally to provide for the decisions they made. So every lawsuit's going to be different. And then there's a third policy that's become available, which I'll talk about. So if someone files a lawsuit against the association and they actually did come down with the COVID virus, there's several things you're going to look at. First, it's the policy, and every liability policy is different. And during this time frame, we're seeing changes because this all started back in March. A lot of policies were silent on some of the bigger carriers like the Philadelphias of the world, Aspen, etc. Well, we're in a general liability crisis in South Florida right now. Some of the biggest renewal months are March and May. And a lot of carriers have gotten out of the business in South Florida. The new carriers getting in the business, like the James Rivers of the world, etc., under the general liability are putting specific exclusions for pandemics, viruses, and they've always had a mold exclusion. So if they physically claiming they got the virus, now, the first thing that you're going to look at is best practices. Is this managed by a third party, like a management company? Has the association done everything they can do? If you followed all those items, that will be looked at. But if there's a specific exclusion under the general liability and they physically got hurt, so they had the bodily injury, it's typically not going to be covered by the D&O. And under some of the new policies, and every policy is different, it's typically excluded. Now, to give people comfort, about 2 years ago, there's a new product put out. It's by Atlantic Mutual. This product is designed, and it's not very expensive, and we've done flyers on it, etc., to basically, I call it the catch-all policy for lack of a better description. It covers claims excluded by the directors and officers liability policy and the general liability policy. There's another one out there also by Bold. The one I prefer is by Atlantic Mutual. So this is a catch-all type policy that says, if the D&O has denied the claim and if the general liability carrier denied the claim, we will pick up the coverage to defend the association with unlimited amount of defense coverage with no deductible. So again, there is no specific catch-all under GL. Every carrier has a different policy form. What I tell people is follow the best practices by your management companies, by the CDC, your local governments, etc. It just provides further support in the event of a lawsuit.
All right, great. Thank you, Richard. Go ahead.
Howard, just to tag on to that from a management company perspective, is Richard's recommendation is very timely in the sense of a managing agent establishing COVID protocols within the association operationally. There should be written protocols and there should be a written record of that in case it comes down to any evidentiary in a lawsuit.
Well, that's a great segue, Doug, because you're next on my list with the question related to that. And that question comes to us from Bill. And Bill's question is, can a property operate with stricter provisions than what's provided under the government emergency orders?
Basically, from our perspective as managing agents, we look to protect our association and its members to the highest level. Therefore, our advice is to basically, they need to go within their association, also to confer with their particular association counsel as to what measures that may be in excess of either a governmental or a municipal mandate, but still are looking towards protecting the best interests of their association members. So in our opinion, yes, they can, in consultation with that association's counsel, to make sure that whatever measures they are taking are well within their documents provided for that association.
Thanks. And I agree with you, Doug, to follow up what you said about going to the association council. That's very critical. Obviously, all the associations, when you're talking about, implementing rules and regulations in response to the COVID issues, you do want to go through your association attorney. It's our opinion that as long as there is an emergency order in effect from the governor, that the boards can operate under emergency powers. So we'll get into a little bit about more of that later, but thank you, Doug. Robert, Susan has a question, and the question I think is a good one that everybody wants to know. So what exactly needs to be cleaned? Well, how do we clean it, and what chemicals should we be using?
That's a what, a how, and chemicals to be used. Very
It's a
good question.
three-fer.
Yeah, it's a three-fer. Thank you. What type of cleaning? I think first and foremost, it's important to retain an experienced company that knows how to clean properly. We're seeing a lot of people that are quoting at 45 cents a square foot, just come in and clean, or just come in and fog and do certain kind of a dog and pony show. As environmental contractors who does asbestos experience environmental cleanups, there's a lot of hands-on touching. We feel that just fogging an area doesn't quite resolve the issue. It needs to be touched, cleaned, felt. And we use disposable rags. We use gloves when we clean the areas. We demarcate the areas. We do plenty of digital documentation to prove that the cleaning was done appropriately. As the gentleman had mentioned earlier, that you guys are trying to protect at the highest level. So you want to show an emphasis that areas are being touched, they are being cleaned, and they are being documented. Chemicals. That's a really good question because I'm seeing a lot of in-house cleaning that is going on. And unfortunately, in-house people that are performing COVID cleaning aren't adequately trained. And it's really important to know the types of chemicals that you're using. Many different solvents require different types of duration that the chemicals need to be applied. Does the chemical or the cleaning solution that you're using need to be applied and allowed to dry? Is the cleaning solution you're planning on using need to be applied and wait for 5 minutes and then wipe it off? Is it 10 minutes to wipe it off? So it's really important to understand the chemical solutions that you're using. And our default, going back as environmental contractors, is read the label. The label is the law. If the label says use as indicated in this manner, that's how you use it. Some of the complaints that we're getting now is that chemicals that are being used or cleaning solutions that are being used have a strong odor. And I've witnessed some in-house cleaning companies or in-house staff that would add, again, no, not referencing any particular brand name, but they would add Fabuloso to their cleaning solutions to try to mask the odors that are emanating from the cleaning solutions. And that's a no-no. You never want to mix chemicals to mask the odor of another chemical. So you use the chemicals that are designed. There's many different chemicals that can be used, but again, you have to use the one that's appropriate for your project and follow the directions as indicated so that the end result is a thorough cleaning. Because when you're done with a project, you just don't want an invoice to say that it was done. hopefully you would have some documentation and some paperwork and some photo documentation proving that it was done and cleaned adequately.
Okay, great. Thank you, Robert. This next question goes to my partner, Jamie. This question comes from Josh. And Jamie, I know this is a question you and I have spoken about directly. And the question is, can a building require employees to take a COVID-19 test before they allow them to return to work?
Oh yeah, Howard, we have talked about this before in the past, and the prevailing wisdom, at least right now, according to the EEOC, is that you can, in fact, require your employees to take a COVID-19 test. Antibody testing is different, and it has been determined that because of the unreliability of antibody testing, that it is not viewed as the same. And for example, you cannot require employees to take an antibody test, but you can, in fact, require them to do a COVID-19 test to actually test for the virus, and you can require it of any of your employees.
And who pays for that? And do they have to wait till they get the results back before they can go back to work?
Wow, so I get a 3 for 2. Okay, so, well, who pays for it? Generally speaking, there's no legal requirement for an employer to pay. Most employers do pay, and reason being is because they want to protect their workforce and they want to make sure that their workforce stays safe, especially if they are the ones that are in fact asking for it. Typically, and it really depends on the employer whether or not you allow them to come back if they have to take a test. So, and I will say it also depends on the circumstances. So for example, if your employees are taking a test because somebody has in fact tested positive and they've been in the building and they've been in close contact for a prolonged period of time with your other employees, you may, and some of my clients have been, falling on the more conservative side where they want to really keep everybody out. But it depends, because if, for example, you are taking other precautions, like, for example, taking temperatures, asking about certain information from your employees, you can bring them back if they don't otherwise exhibit symptoms and they're otherwise waiting for a test result. But the other thing I will note, and this is because it's a loaded question, under the Families First Coronavirus Response Act, if, for example, a person is waiting for a test result and they're actually experiencing symptoms, they would be entitled to paid leave to sit out while they're waiting to get those test results back from the testing facility.
Okay, thank you, Jamie. Let's go back to Richard with another insurance question. And Kathy asked Richard, in wake of the current events, how do you expect this and past events to affect the insurance industry on coverages and costs in particular?
All right, before I get to that, I just want to answer under the questions and answers. I saw a couple questions. 2 folks asked, number 1, can I still get this policy? Number 2, which policy was I talking about? Isn't it too late? The policy I was talking about is by Atlantic Mutual, is the catch-all policy when claims are denied by the GL or D&O policy. And no, it will still cover COVID lawsuits or any lawsuits for that matter, so long as that lawsuit hasn't already been filed. So I just wanted to touch base on that, and it's by Atlantic Mutual. I believe the question you asked me was, with the current events of what's going on, how is this going to impact the insurance industry? I'm going to back up about 2 seconds. For almost 5 years, and we're talking to a large group here, and there's multiple types of buildings. We have the buildings built after 2003 that are high rises, which means they're all impact glass and fully protected. Those have seen the least amount of impact on increases as it results to the property premium, which is the majority. Then there are older buildings that are not protected, which means impact glass and shutters. Those took severe increases this past year. Because we did have falling rates since 2014. Then we also have garden style, which is the 2- and 3-story buildings that are typically more out west. A lot of those are not protected, and those are going to vary. So right now, in the past 12 months, we've seen two very hard markets hit simultaneously. The first one is the property market, which is the lion's share of the premium. It probably represents anywhere from 60 to 80% of the total association budget for insurance. And then the general liability market. The general liability market in Tri-County, which is Dade, Broward, and Palm Beach County, we've lost 5 insurance companies over the past several years that have said, we're out of here. I didn't say charge more money, they left. That's Colony, Great American, Endurance, Burlington, and American Family. The Colony one was important because that was a proprietary program that I put together with my company years ago. That had 40,000 units in it, and that started non-renewals in November. So a lot of the folks probably saw pretty good size increases on their renewals between December of this year to currently. So I'm going to answer this in a couple of ways. We're through the hard part. The area I can't answer is what's going to happen with this hurricane season. The reinsurance rates have gone up significantly over the past several years. That's what drove the property increases. It had nothing to do with the pandemic. We're seeing property increases that may have gone up anywhere from 15 to 50 or 60% on the past renewals. Are they going to go up again this much next year? I think on the high-rise buildings, the 3 major carriers are Everest, Steadfast, and QBE. On those, I think you're going to see 10 to 20% without the appraisal on the property. Now, that's subject to not getting another Category 5 hurricane hitting again this year. That's why I hesitate. We're really just starting hurricane season. You won't have a very good handle on this until probably September, October, and I know everyone is bombarding everyone. I know the management companies, and Doug will share this with you, they're all asking for their budgets. So we're very careful on how we're telling people to budget, and every single one will differ. But to repeat myself, the high-rise buildings that are protected after 2002, and some of them are protected that are older. If you're with a QBE, Everest, or Steadfast, you can expect anywhere from 10 to 20%. On the garden-style buildings, which could be Steadfast, formerly Empire, American Coastal, SRU, I think those are also going to see some property rate increases anywhere from 5 to possibly 20%, depending on your claims history. On the older unprotected buildings above 3 stories, they took the biggest hit last year. Those are the ones that took 30, 40, and 50% on some. Again, this is Dade and Broward County mainly. Very different if we go to Orlando, West Coast, etc. I don't see those taking another 30 or 40% hit. Those markets could be anywhere from 10 to 25%, but again, subject to the hurricanes. Under the general liability, which is a much smaller policy, I think that's settled down. Where that gets very, very difficult is if you have claims history. If you have claims history, you're going to continue to see more and more exclusions. You're going to see deductibles, and you're going to see large price increases. And why is that for Tri-County? Philadelphia, which is one of the bigger carriers for liability in the state of Florida, very well respected. Their loss ratios in South Florida was 250% higher than the rest of the state of Florida. So a lot of these carriers don't even want to write in South Florida. The bigger concern is making sure you understand the exclusions under liability. I've seen some very bad lawsuits where the carriers are coming in with these exclusions and they need to be focused on by management and by the other agents. They're requiring all subs or certificates, name the association's additional insured. Well, just because you have a certificate doesn't mean additional insured. If you don't have that language on there, they can deny the claim if something happens. I saw one judgment over $600,000 because of that exclusion. We're seeing assault and battery sublimits. We're seeing a lot more exclusions. So you really need to, I recommend pre-renewal meetings 90 days prior and go through the policies. Say, is there anything we need to know about here? I understand money is important, coverage is more important. Let the board make the business decisions. So that's my answer on that.
All right.
Just to dovetail into what Richard said on 2 very important parts, and I'll be brief. is one is we're seeing some of the high-rise older properties start to think about getting better ratings for wind mitigation by either requiring those residents who have not put in impact windows, and again, this would be in conjunction with your docs and whatever things that you would have to do to get something like that enacted. And also, one of the things too is, as Richard basically said with the liability, one of the things that we require in terms of capital projects where you have large projects with potential liability is not only the certificate of insurance, but we require the contractor submit their entire policy for our broker's review to make sure that they have no exclusions as well.
Great, thank you. Robert, I want a question here from Ronald, and it sort of addresses something that you discussed a little bit earlier. And the question is, we're going to be fogging the clubhouse with disinfectant, and it is 16,000 square feet. Number of units, large ballroom, etc. How often does each area need to be fogged with disinfectant? And I think you had mentioned fogging earlier, so would you expand on that, please?
Yes, thank you. Again, as an environmental contractor, fogging, in our perception of the world, is kind of like spraying perfume without taking a shower. It's just a coating and covering. As environmental contractors, we prefer to touch things, touch the surfaces, clean. There was a question previously, can we use 70% alcohol and spray on a surface? Well, that's just adding a chemical to it. But are you really touching the surface? Are you just laying it over it? And is it really being cleaned and disinfected? So again, I have a tendency to lean towards touching. When we do large areas like clubhouses, we do make a site visit to view how well the areas need to be cleaned. I know there's clubhouses that contain, lately I've came across a clubhouse where they were storing a bunch of chairs in the clubhouse. Well, from an environmental perspective, I would have touched every single chair, as those are high contact areas. A fogging is not necessarily going to get to the nooks and crannies of those high touch areas. So is my first recommendation to do fogging? Well, those are financial decisions that condo boards and associations need to make. What is the plan that you're planning to use, and is your contractor going to stand by it as far as effectiveness and the thoroughness of it? How often should it be performed? That's a decision, because as we all know, the moment the cleaning is being performed, the moment you walk away, it can be reinfected soon afterwards by somebody who is not practicing preventive procedures that are in place. You go into a lot of buildings and they have the signs that are up that general provisions, these are placed all over the place. And unfortunately, I don't see anybody really reading them. They're given forms to be placed in front of structures, but nobody's explaining the process. So if you fog a facility, that's kind of one half of the procedure. The next step is to make sure that people are adequately trained, educated on how the process works, and that'll help mitigate a future exposure.
Thank you. Doug, this next question is for you, and it's from Paul. And the question is, how can a board enforce emergency orders and internal regulations and rules and regulations?
It's a good question, and it's one that we come up across since all of the, there's been a myriad of different municipal regulations in place in terms of businesses. And basically the answer, or the helpful things to this is you basically also have to look at your documents to see what enforcement policies your documents provide for, whether they be fines, whether they be grievance committees, things such as that. Also, one of the things that some of the counties, particularly Broward, Miami-Dade, and even Palm Beach, have had enforcement provisions within these executive orders. And some of them may enlist some of the county's health department, or in some of the more stringent and recent ones with the wearing of PPE or face coverings, allow for even the local law enforcement to get involved. But the first enforcement is obviously with your residents to make sure that they understand what the policies are and why you're doing it. And we all like to think that we're all in an association and we all live together and we all want to protect each other, so that it shouldn't come down to a few who won't apply to the rules. But there are enforcement both under the documents and then also under the orders themselves.
Thanks, Doug. And I want to add to that because, you know, you probably have 98, 99% compliance. Most people want to cooperate. Most people want to do what's right. Unfortunately, you always have that, you know, maybe one in a building or one or two, if you're not lucky, that just don't want to comply. They either don't want to wear a mask in the common areas, or they're supposed to be quarantined because they've tested positive, or they come from one of the, you know, it's a little ironic now that there's a quarantine order in effect if you come from New York, but we're now the epicenter, but that's a different story. But there are owners who don't comply with that, and I have boards that want to know what can we do where these owners just blatantly refuse to comply. And you can get with your association attorney. The attorney can send a strong letter. We've been sending letters that say, this is what you have to do. If you don't confirm with me in 24 or 48 hours that you agree to this, we're going to file a motion for, you know, injunctive relief in the court. That is a drastic measure. But if somebody is, you know, violating quarantine or doing something to put the other residents in the building at risk, something the boards may want to consider in conjunction with their management company and the attorney. So I want to add that as well. Jamie, Beverly would like to know, and this question came up a lot. What is your advice regarding notification of the community that a resident or employee has tested positive for COVID-19?
Yeah, Howard, I get that question a lot. And first and foremost, there is no legal obligation to tell either residents or employees that someone has tested positive. There are concerns legally, especially under the ADA, about people's right to confidentiality when it concerns medical information. And so while there a lot of times is a natural curiosity about who it is that's tested positive and whether or not there's an obligation to in fact inform, every circumstance is different. It also depends on, you know, what the board wants to do. If it's an association, any other type of employer, they have to make a business decision about whether or not they want to make certain information known. Typically what I advise, and I think most people have advised, is, you know, to keep it as general as possible and to only provide really a minimal amount of information. For example, to let people know that someone has tested positive. Sometimes it's the worst kept secret because in a smaller building with not many employees and somebody's suddenly gone for several weeks, yet a lot of people may suspect or think they know, and they may know if somebody, for example, tells them that they've in fact tested positive, but there's no legal obligation to let everybody know. But a lot of times, most employers will let people know, and they will specifically let people know if they're aware from the employee that's tested positive that they've been in close and or prolonged contact with other people, to let them know so they can take whatever precautions they feel are appropriate, including possibly getting tested themselves.
But there's no legal obligation to make that disclosure. Is that correct?
No, yeah, no legal obligation. It's really more of a moral, or, you know, people feel that it's the right thing to do. And most people want to let other people know, but they're just cautious about the kind of information they give. And that's what I really call the necessity. And in my mind, the person's name is, like I said, it's natural curiosity, but the name isn't really what matters. It's the fact that someone has tested positive, that they may have been in contact with, and they need to take whatever precautions that they need to do on their own behalf to make sure that they're safe. And if they were infected by this other person, to take measures themselves to, one, get better, and two, to be safe and to not infect other people.
Thank you. Doug,
Richard, I mean, Jamie, to tie into that, one of the things that we've established the protocols in our managed properties is with our staff, and also if a resident has notified us, we do, and we follow the CDC guidelines for contact tracing. And we do that with every case that we have come in across or we've been notified with, so that we can establish and figure out, and also then notify people, obviously with the guidelines, if they have been potentially exposure to it. So it's very important from our standpoint, since we're dealing with residents and staff, that we do the contact tracing as well.
No, and to your point, Doug, I think that's really one of the first things that come to mind, especially for employers that feel compelled, to let other people know. And from my perspective, really that first question that you have to ask is, one, when, did you test positive? Confirming whether or not they've in fact been at work or they've been to the building, and then separately asking them to list any individuals that they've been in close proximity and or prolonged contact with. So then you can start and do like what you had mentioned, what the CDC recommends, and letting those people know so they can take precautions as well to protect themselves.
And Doug, you say you do contact tracing, and I'm just curious, how do you handle that without disclosing the identity of the individual who is infected, if you can?
Sure, absolutely. And we handle it basically the same way we would handle a general notification to an association, considering if someone has tested positive, i.e. the staff, or even a potential resident. What we would do is, and let's take an example that a front desk individual, it notifies us that they've tested positive. We do contact tracing, as I said, per the CDC guidelines, which basically say within a 6 foot, closer than 6 feet for a time period of more than 15 minutes. And let's say we have someone who says, look, I was with Mrs. Smith from apartment 302. She was at the desk with me and we were talking, or one of the maintenance guys, and it was things like that. What we'll do is we'll notify that person individually, and all we will do is keeping, as of the ADA, total anonymity for the person who reported it, and just say that in our contact tracing, it is a potential that a person who has announced they've either been tested positive or quarantined, that they may have come in contact with you. Please act accordingly under the CDC guidelines.
Great, thank you. Robert, Mary has a question that you touched on a little bit, but maybe you could expand upon. How soon can we use the areas once the cleaning has been performed?
Very good question, Mary. It really depends on your contractor and what type of chemicals or cleaning solutions are being used. When we set up our work areas, and sometimes we do quite large areas, sometimes we have to compartmentalize those small little brief areas because it's a little bit too difficult to take on an entire hallway. So we will break it down into a much smaller region, add our HEPA machines in there, set up our barricades to prevent unauthorized entry while we're performing our cleaning. Generally, with the solutions that we use, after we are done with an area that has been cleaned and we transfer over to move to the next area, that area can almost immediately be used. We would like it to usually wait just a few minutes to allow the surface just to thoroughly dry, and make sure the people that are entering the area are wearing protective respiratory protection and gloves, because we would like to try to avoid is a cross-contamination of a recently completed and cleaned area. So the answer can range from a few minutes to a half hour, or to whenever hopefully the experienced contractor you're using will allow. There may be logistics where the contractor may say, you know what, let us finish this entire hallway, and then we can allow people to come into the work area. So it's important that when you start a project that you have a good plan in place, and those questions are also addressed so that people are aware of what's being performed and what to do next as soon as the project is completed.
Great, thank you. Richard, this is a question as association counsel we get a lot. And this question is from Karen. And the question is, will use at your own risk signs protect the board and the association from a lawsuit if a resident contacts the virus from using the facilities where such signs are located, like the pool, the gym, that sort of thing?
I've talked to attorneys before. I've talked to the insurance companies. From what I'm learning, it doesn't hurt, but I'm not sure of how much good it does also in a lawsuit. It's really more of a legal question. We're trying to be proactive. I'll go back to what I said earlier on best practices. You can do, the board and the association can do what they want. Just try to follow best practices of the CDC and the management company. It never hurts to put up cautionary signs. That's why they require them at pools. That's why they require certain things in gyms by the city or the county ordinances. So it does not hurt, but it's not a guarantee in a lawsuit. You can even get releases. We've asked certain association attorneys for, do we get a release if you use the gym? And I've seen varying opinions on it. At the end of the day, it doesn't hurt, in my opinion.
I agree it doesn't hurt. I think, like you say, at the end of the day, the association has the obligation to provide a safe environment for use of its common areas. I think what you're saying, and I would agree, is that while it doesn't hurt, it certainly doesn't, negate much, if any, of the liability that may incur if they don't take the proper precautions. So I think we'll leave it at that. All right, let's see. Jamie, this one's for you from Lynn. Once an employee tests positive for the COVID-19 virus, what are the protocols or requirements for allowing that employee to return back to work?
I think that's a really good question, Lynn. And I think it's important to make sure that, one, the employee does not come back to work after testing positive until the employee tests negative, first and foremost, but then secondarily, to make sure that the employee doesn't have any signs or symptoms or any continuing signs or symptoms of COVID-19 for at least 72 hours, 48, 42, but it really depends on how comfortable you feel, but I would suggest anywhere from 24 hours of being symptom-free up to 72 hours being symptom-free. And then, really the protocols once they come back, like I said, first, the negative test, but the protocols when they come back are really the protocols that should be in place before, to make sure that you are doing things to make sure that the workplace is safe. For example, employees should be social distancing. And as you see, Doug's wearing his mask because he's in the office, but asking them and telling them that, your policy, at least for the near future, until we tell you otherwise, is that social distancing, wearing masks, frequent hand washing, making hand sanitizer available, really doing what people need to do to help slow the spread. And so those are things that, like I said, should be happening beforehand. But then even more importantly, once somebody has tested positive, to continue the diligence. I know it's tough and a lot of us feel the fatigue, but it's just really important until we are at a point where and hopefully we'll get there soon, either with herd immunity or through a vaccine at some point, where we feel a little bit more comfortable. But a lot of these restrictions, in my opinion, are here to stay for a good period of time.
Thank you.
Just to tie into what Jamie said, last week, I think on the 20th, the CDC basically issued revised guidelines for back to work for two classes of employees. One was for healthcare professionals, the other was for just normal employees. And from our perspective, as an employer of over 500 people, if we have someone who is out who has tested positive, even though the CDC has somewhat relaxed their testing to return to work for non-healthcare professionals, we are still requiring it to have a negative test before they can return to work. And as Jamie very importantly said, once they come back to work, they go back into the rotation and into the protocol that they were before in terms of screening and every day with temperature monitoring questions, that type of thing.
Thank you. Richard, another good question for you. This question popped up a couple of times from people that submitted questions, and it's sort of a multi-step question, but what exposure does a board member have personally if they're sued and related, to a COVID-19 exposure, and should they resign to protect themselves?
Okay. Good question, because we know, everyone, how well the board members are paid. It's a great job. And the paycheck's amazing. Why anybody does it, God love you for it. Let's talk about that, and I'll be brief. Most associations, 95% or more, are in risk purchasing group D&O policies. That's why they're so inexpensive. If you ever look, the D&O policies typically range, unless there's a claims history, $2,500, $3,000, $4,000. They're very inexpensive. And that's because they're part of these risk purchasing groups. Why it's so important? They're put together extremely well to protect the board members. Travelers, Philly, Great American, etc. All of those policies cover the board members personally and follow them when they get off the board. But that's based on the decisions they make as a board member. Can you be sued personally? Yes. The policy will follow you so long as you're just working on behalf of the board. So would I resign? No. Do I have proper protection as long as it's part of one of those normal policies, which, again, to repeat myself, is 95% or more? The only time you get higher than that is when they've had claims history. And you'll see companies like Lloyd's or RSUI, that's when you want to read. But if it's a name that you know, it's not a concern. It follows you when you're off the board and while you're on the board and personally.
I guess the most important thing for the board members is to make sure you have a valid D&O policy.
I would not get on any board without seeing it and even running. And it also covers, which we didn't touch base on, any committee members, any social committee members, etc., that are appointed or elected by the board, which is important to know. And it also covers the board member's spouse.
Interesting. I guess I got to get married then. All right, Robert, this is sort of I don't want to say a ridiculous question, but it's a question that I believe has an obvious answer. So I'm going to ask it. The question is, management doesn't think we need to do anything as far as sanitizing our restroom, clubhouse, and pool furniture or closing the areas to the public. What do you think?
Wow, that is a good question. You know, there's always a tendency, and I think Richard said it best, you know, best practices and procedures. And unfortunately, this turns into a monetary situation. And what is the right thing to do? What is the appropriate thing to do? And when people want to, I'm going to say, cut corners for the cost of saving money, I think the liability of those situations increases greatly. So, I mean, this COVID cleaning, and in general, when I see the numbers, it's a small price to pay for a small bit of insurance to know that it's being done right. Again, and you're right, it is a common sense question. When in doubt, do it. And that would definitely offer a better protection, because if it wasn't performed and something does happen, you know, I think attorneys that may be in the industry may see that chock full of holes on how they could tear that apart, because you had the opportunity to do it right, but you didn't practice the best practices available or make the best decision possible.
Thank you, Richard.
I also, as a managing agent, would be derelict in our duties if we did not recommend such procedures to a board or to an association to protect them.
Yep. That's what they pay you the big bucks for, Doug.
Almost as much as the boards get.
And since we're talking, Doug, here's a question from Terry. Where does a board's power end as it relates to COVID-19, and how does this pertain to reopening of the building and amenities?
Okay. Again, one of the things that we go back to is this is also a question that we work in consultation with an association's attorney to determine. As most everybody is aware, earlier in the pandemic, the DBPR had put together something that said the board had, or the COVID pandemic fell under the board's emergency powers. And then a few months later, they rescinded that or ended that determination. So basically, it's a consultation with your management company, with the board's attorney, and as to when, you know, what you should do, when you should end it. Again, this is not going away anytime soon. So one of the things that we also speaking to a number of our boards is to potentially amend documents to now treat this as a pandemic, which may become in the future as well. So policies and procedures may be best done by amending docs so that the future boards will have a clearer roadmap on how to handle something like this.
Great. Jamie, a quick question that popped up. If an employer requires their employees to get a COVID-19 test and the employee denies or refuses to get that test, can that employee be fired?
Yeah, so this is another one of those questions I surprisingly have gotten a lot. I think that employers have options when it comes to that. And while we had talked about it earlier, you can require employees to get tested, but obviously there are people who will refuse testing. Most employees will agree. It gives them peace of mind. It gives their coworkers peace of mind, especially when they know that there's nobody else that's positive. But if an employee refuses to get tested, I think the first question is why? And you need to find out if there is, for example, either a medical reason and something that would be covered under the ADA that a person is refusing to get tested, or a religious reason why the person is refusing to be tested. But, again, like I said, there are options. And so, I've had clients that have asked the person to stay out of work. And for some people that may mean being out of work and being unpaid. Another thing that I think an employee could do is to go see a medical provider and have a medical provider who then does an exam, and maybe not necessarily testing, but at least provides the employer association some assurance that the employee is in fact safe to return to work. And then, negative testing, I mean, you can always say it's an option if that's what the person wants to do. But I always think it makes sense, especially when we're in COVID-19, to be a little bit flexible. Because sometimes I think you need a little bit of that flexibility. And well, listen, Florida's an at-will state, and you can terminate somebody for any lawful reason. We're dealing with a pandemic, and there's not always going to be what appears to be the definitive black and white answer to something. So I think you have to really evaluate. I think every situation's different, and if you have concerns or questions about making a termination, then you should obviously reach out to somebody who can at least be, a gut check to give you peace of mind before you go ahead and make a decision to terminate.
Thank you. I've got a number of questions that have popped up from the people who are listening to the seminar. Excuse me. And there's a number of them that basically ask the same thing. They're asking for advice about opening or closing the pools, limiting the building to guests only, limiting the pool to residents only, prohibiting guests, closing the building to guests, and that sort of thing. And I want to talk about that for a minute, then I'd like to get some input from Doug. But my response is, because we get it a lot, they want to close the building, they want to restrict, contractors can't come in, housekeepers can come in, but realtors can't come in, and they're trying to make these distinctions between who can and who cannot come into the building other than residents. And the way I look at it is you're either pregnant or you're not. The building is either open to outside people or it's not. So I think the board has the right under its emergency powers to make that determination. I think the board can say, no guests, no contractors, no realtors, no housekeepers. Obviously if there's an emergency or if your air conditioning goes out or if there's a medical issue or if you have a nurse or something, that's a different story. But these are issues that a lot of buildings are dealing with and asking questions. And I think the board does have the authority to do that. I've actually been involved in a lawsuit where somebody challenged the board's ability to do that. And the challenge was that it was not reasonable because it was selective enforcement. They didn't allow a contractor in, but they allowed a housekeeper in. They didn't allow a realtor in, but they allowed, somebody's trainer that came 3 times a week. So I think keeping it consistent is one thing you have to keep in mind. And Doug, feel free to jump in on that if you'd like.
Sure, absolutely, Howard. And I think your analysis is very good. The boards, do have powers under the emergency powers to do it, but also you have to also communicate with residents. One of the things that we find is that a lot of times a board will, just promulgate something without any input from residents or without any introductory to it or whatever. So that one of the things is communicating with your residents. The other is, if you are going to keep amenities open, such as a pool, such as allowing contractors to work, allowing, housekeepers in, that type of thing, real estate, is that you establish protocols for it. So for instance, with contractors, if you have a dedicated service elevator, that there can be no more than X number of people in the elevator at a time. PPE has to be worn by all contractors, masks, gloves, in all common areas of the building, no matter, where they're going, what they're doing. Pools, again, there are a lot of associations which are continuing to keep their pools open, but are restricting it to just residents only. So that's another option. One of the things too, and I think a lot of this tends to stem from the fact when the situation was reversed and we were quarantining people from New York as opposed to what we're doing now, where we're the ones that have to be quarantined. So things have changed a little bit, but again, with the rise in the cases in Florida over the last month, since we started reopening, I think boards have to act with caution, again, within their rules, and again, with communication to the membership.
Okay, good, great, thank you for that. And I'd ask you to answer this one too, Doug, because I'm sure you've dealt with it. How do we have our annual meeting with COVID-19? We can't meet in person.
Right. There's a couple of avenues there to do. One, there's obviously as to what we're doing all now, which is Zoom meetings. Okay. There is also electronic in terms of voting. If for annual meetings, there's electronic voting that can be done. Also, and again, Howard, I'll throw this back to you or Jamie, in the sense of, I know it was apropos during when the DBPR allowed the board to have emergency powers, is that there was such things as postponing the annual meeting. Things along those lines, if it was set in a date, obviously in the docs. But there are ways to do it electronically. There's also ways to, in terms of, some people may not be able to vote electronically if you do that, which involves a whole protocol that you have to establish beforehand. But there is also the requirement that people have the right to send in a paper ballot. And there can be areas in a building where you can put that, a ballot box in and then still do the electronic voting as well.
I mean, and again, those are good questions, and there are ways to do it. There's ways to conduct your annual meeting. There's ways to have election of directors. There's ways to have special membership meetings to vote to waive reserves on amendments, whatever the membership would normally do. There's ways to do that via Zoom, limited proxies, mail-in ballots, and that sort of thing. Doug mentioned the emergency powers. That's a whole nother discussion about the governor, not actually the governor, the DBPR administrator saying the emergency powers were in effect and they're not in effect. And I'll dovetail that into one question that came up on the board here. It was a question that was for Doug, but I'll answer it. Question was, do different attorneys give different advice? And I always tell people, if you ask 2 attorneys for an opinion, you'll get 3 opinions. So I think we would agree on that. Robert, I got a quick question for you. How do you clean elevators? There you go.
Yeah, good, thank you. I was making notes because I was going to tie that into another question. Cleaning elevators, it goes back to what does the label say on the solution that you're using to clean an elevator. We typically apply the solution to a new clean rag, and we either wipe the surface or we actually apply a mist type solution to the buttons and follow the directions of the surfaces for allowing appropriate drying. You definitely want to hire an experienced company that's going to be doing your cleaning. There's a lot of people that are jumping on the bandwagon. Similar to after a storm, we get people coming in from out of state I've noticed a frequency of COVID-19 cleaning on on the sides of vehicles. I've noticed it on the side of termite cleaning companies. I've noticed it on the side of plumbing companies. So it seems like everybody's just jumping in and doing it. I would strongly recommend and encourage that you hire somebody who's experienced, who hires a plan, somebody who has been trained on how to properly clean it. And that ties into, do you want your staff to do the cleaning? Are you doing it yourself, or are you hiring a professional? And if you do it yourself, educate yourself on the appropriate way to do it. Read the labels. The information is readily available on how to clean the surfaces. If I'm not mistaken, the CDC does pull out methods and procedures on how to clean surfaces, as long as you follow the directions of the company, of the chemicals. So yeah, and there was another question that tied into about gloves and recontaminating. You know, I honestly don't know whether you have gloves. I mean, if you wear gloves, you're constantly touching surfaces. So the moment you're cleaning an elevator, if somebody grabbed the handle outside of the building, walked in and pushed an elevator button, there's a very good likelihood that an area can be cross-contaminated. So again, it's cleaning directions, it's educating yourself, it's learning, and it's hiring somebody professional. And to tie into another question, somebody had mentioned about testing. You know, we had a testing company come in. What do we do now? Our default is go back to the industries that have already been established that follow some guidelines and rules. If you hire a testing company to perform a testing, they should offer you the recommendations based on their findings, what should be done. Because to hire a company and say, what are my test results? Oh, we tested for positive. What do we do now? Well, an environmental company will do a testing and offer the recommendations and give you a plan, just like you would find in a mold protocol or an asbestos survey.
Robert, I got to cut you off because we're coming up on our time, but thank you. I'd like it to go around and start with Doug, maybe 30 seconds of closing comments, Doug.
Sure. I just want to say to everybody who has joined the webinar, who's online with it, you know, most of them are from associations. And I think one of the things from a management perspective that we would love in our associations and all associations is to take this seriously, to take the rules and regulations that have been promulgated by your boards, by your management companies seriously. We're all in this together. We all live together. We live in tight quarters. So, you know, from wearing a mask to social distancing, this is how we're going to beat this until we get a vaccine. So again, please pay attention to the rules and regulations. They're put in there for everybody's health and safety, including yours. And I just want to say thank you, and to everybody, stay safe, and thank you for the opportunity to discourse on this very important subject.
Thank you. Richard, 30 seconds.
Yeah, the only thing I'll add is for everyone that's on a board, or anyone else for that matter, ask to do a pre-renewal meeting. If you have a renewal coming up in the next 90 or 120 days, ask to see your agent to understand what you're getting and anything else that you may need to protect yourself.
Thank you, Richard. Jamie?
Yeah, I mean, I think the important thing is like what Doug said, is to be safe. I mean, you know, as far as it concerns employment land, I think you got to be flexible. I think you got to be mindful of the law. And importantly, if you have questions, reach out and talk to somebody and get the answers that you need, whether it's from any of the professionals here or otherwise. But again, everyone be safe, and thank you for tuning in.
Okay, Robert, bring it home.
Ladies and gentlemen, we're all professionals. Let's hire professional people and appreciate the good opinions and advice that we're being given.
Thank you, Robert. I want to thank everybody for attending. I especially want to thank my panelists. Like I thought, the hour flew by. I don't know where it went. I want to thank all the participants for sending in the questions and watching us. And again, thank you to the panelists. And if you have any further questions or your question wasn't answered, please feel free to reach out to us. Our name and contact and email information are on the screen here for you. That'll stay up there for a few seconds or a few minutes. So again, thank you very much for participating. Stay safe and see you next time.